Dr. Alex Ljungberg is a emergency room physician with UBMD Emergency Medicine, and he works at Suburban Hospital. Doc, thanks for joining us today.
No problem. Glad to be here.
What we want to do is get a little bit of an insight from those on the front line, what you're seeing, what you're dealing with. So we want to see what you have experienced in dealing with the coronavirus. Before we do that, if you can, tell us a little bit about yourself.
Well, I'm a Buffalo native. I did residency here at the University of Buffalo's program, and I've worked for UBMD Emergency Medicine since 2015. And I'm currently the Associate Director of Emergency Medicine at Millard Fillmore Suburban.
So with that training, your education, your experience, you've seen major disasters, public health issues, things like H1N1, the SARS virus over the years. But this seems to be much, much more different. If you can, tell us the difference between what you've experienced in the past versus what you're dealing with today.
I think the thing that's different about this is number one, the pervasiveness. It seems to be everywhere. And the news coverage surrounding it, I think, is really kind of heightened the anxiety for a lot of people when it comes to this disease that we haven't necessarily seen previously, and also because it's just so widespread. I mean, it's literally involving the entire globe. So you can't escape it, you can't avoid it. And I don't think anything in anybody's training necessarily prepared us for this particular event, but I do feel like we are prepared for, public health disasters such as this.
Yeah, I know when we talk about how emergency room physicians, more than anybody, are prepared for the unexpected. They're trained for that type of scenario. How much has this played into how you guys have responded in terms of we're ready for it, we've been trained for it, we've done disaster drills and all that? How much of that training experience plays into this?
I think it's a huge part of it. And myself particularly have an EMS background as well. And so, there's a lot of, training that goes into incident command type things and preparing for worst case scenarios. I don't think that any of us thought the worst case scenario would be like this, but I do feel like once it hit and the reality was that it was going to hit Buffalo and New York, we really got into the mode of basically, rapidly identifying what we needed to do to be prepared as a hospital and a hospital system for dealing with this. We've done a lot of meetings with, leadership from Suburban's emergency department, but also the other Kaleida facility emergency departments, and have really tried to, have a cohesive, unified plan and how we're going to deal with this.
So take us into the front line here. Take us into the emergency room. And for those who are watching today, what would they see if they were walking in your shoes? Have things changed in terms of patient flow, the amount of people in? What's it like knowing that you're dealing on a daily basis now with positive COVID patients?
It's actually, we were just talking about this yesterday. It's almost kind of eerie because the other services at the hospitals are very limited, elective surgeries and that sort of thing. So the hospital feels empty, and our volumes are down in terms of emergency volume. But the patients that we have seem to be quite a bit sicker. In any shift, we're seeing, 10, 15 potential or known positive COVID patients, sometimes more, sometimes a little bit less. A lot of them aren't gravely ill, but the ones that are very, very sick. And so it's kind of an interesting feeling because you're very busy, but you have fewer patients. Just because of the acuity and how sick some of these patients are coming in. And then combined with the fact that the rest of the hospital is seemingly, much more empty it's kind of an eerie feeling, if I had to describe it.
Sure. I think one of the things that people may not understand is the prevalence of the nursing home patients that Suburban is seeing, where some of the other hospitals that are dealing with COVID patients are getting maybe those who are coming by ambulance are actually walking in. If you can, tell us what that's like and having to deal with the nursing home patients that you guys are getting literally on an hourly basis, not just a daily basis.
Like anything with geriatric medicine, it has its own unique challenges. Sometimes the histories are limited because of the patients. Some of them have dementia, some of them have unique conditions due to their age. And that's what we're starting to see at Suburban is, an increased prevalence of dementia patients and otherwise elderly patients that also are infected with COVID. And like you said, it presents a very unique challenge because, they can't give us a history of how sick they may or may not be feeling. And also social isolation with that age group is a little bit tricky, particularly again with the dementia patients, because they, don't understand the concept of self-quarantine. And, so they're coughing and not wearing the masks and don't understand what's going on. And so that makes it very challenging to both, for their healthcare, but also for, protecting everybody else around them.
Sure. Working in a hospital or in particular the emergency room is stressful enough. What has this public health crisis done for those like yourself who are dealing with this on a daily basis? What has it done for your stress level or those that you work with, whether it's the nurses or the ancillary staff? Tell me a little bit more about that.
Well, I think initially the stress level was quite high when we were in the planning phase of planning for a potential surge and planning for, where we're gonna put these patients, how we're gonna care for them in terms of PPE requirements and that sort of thing. And I think now the anxiety, I think, is the best word to describe how people are feeling with this. In terms of staff, there's almost a feeling of, am I going to be next? Like I mentioned before, I had the unfortunate distinction of having coronavirus about 3.5, 4 weeks ago. And even from my personal experience, fortunately I didn't get that sick, though a lot of people are. The anxiety was by far the worst part. And I've spoken with some other nurses and other staff who also contracted the virus. And that was their same feeling, is that the anxiety was probably one of the worst parts of getting infected. Fortunately, we all, got better. And I think that is carried over too in the feeling with the staff. There's definitely some underlying anxiety because there's so much unknown about this virus and what it can do and who it's making very sick and who it's not. I mean, it is getting some young, otherwise healthy people very sick, and it's sparing others. And I think the unknown is what is keeping everybody kind of on their toes.
Sure. So you mentioned you unfortunately, tested positive and had to deal with having the coronavirus. But you look at statistically, across the organization, amongst our 10,000 employees, it's less than 1.5% who have contracted it. So, what it would lead you to believe is those who do have it are getting it from the community spread, not from coming to work. So if you kind of explain the difference of community spread versus contracting it while dealing with a positive patient.
Yeah, and that's actually one of the things I thought about, is because, when I contracted it, it was late March. And so it was, before we were really seeing a lot of those patients in the hospital. Actually, just a couple of days prior is when we started seeing our first tested positive cases. So I'm not really sure where I contracted it, but most likely, like you said, it was somewhere in the community before we had all these measures in place. And, I think within the hospital, we've done a pretty good job of responding to the need for PPE and being very cautious with these patients. And I think that certainly has mitigated the spread within the healthcare workers. But like you said, there's still, out in the community, people not wearing masks, not following social distancing, that sort of thing. And I think that is, a more dangerous spot than within the hospital a lot of times.
Sure. Let me take you back to the emergency room and the team aspect that you guys have in place, because it's not just the physician or the nurse. Tell me about the team that surrounds you on a daily basis and how you guys attack this and make sure that not only people are safe, but the patients that are coming through the door get the appropriate care and the appropriate level of service.
Yeah, I mean, I can't really say enough about the team in general. I mean, it's like you said, it's not just the physicians, the nurses, the aides, the secretaries, the EVS workers, the kitchen staff. Anybody who's working actively within the hospital is gone above and beyond to make sure that the hospital environment is safe for our patients, safe for our staff. And, there really has been a sense of teamwork with everybody involved, that, we're all kind of against this virus together. And it really has created that sort of, collegial atmosphere where everybody is looking out for one another. But I can't say enough about the teamwork from everybody across the board.
Well, let me add one more to that team aspect. And really, that's the community. If you can, last question as we wrap up, tell us what it's like to know that the entire community, Buffalo's the city of good neighbors, but to know that the entire community is there for you guys and supporting the hospital system and healthcare workers.
It's it has been, I'm not sure what the word is, but shocking, probably not, but just really incredible, inspiring to see the outpouring of support from the community. It really lifts, I think, everybody's spirits, myself included. It's honestly hard to talk about without getting a little emotional, because it really is just incredible to see, and even from community, from other physicians, from other staff, and just kind of the whole aspect of everybody coming together and really supporting the healthcare system and what we're doing. It really has been an incredible feeling, from the food donations, from the signs in front of the hospital, and just people saying thank you, which is, I feel like I'm just going to work and doing my job, but I realize that it means a lot more to a lot of people out in the community that were there dealing with this.
Well, it certainly does mean an awful lot to those in the community. So on behalf of not only a grateful organization as Clyde Health, but for the community, thank you for all that you do and for your coworkers. We appreciate all that you guys are doing for us as we deal with this corona health virus. Thank you.
Thank you. And thank you to the community for following social distancing and staying safe.